This is the Aware Families Podcast, the show that brings you a science-based, practical look at how to use the principles of functional medicine to keep your family healthy. Welcome back to the Aware Families Podcast. I think we're on to episode 8.
Yeah, episode 8. Wow. Hard to believe.
Yep, and we are through with the 6 pillars. We just finished the last pillar, which was sunlight, nature, and environment. And so that was kind of like the basics of I think the sort of the foundational things that we try to have people focus on that support health before we kind of go off on the many tangents that we can go off on with health and things like that. Like pay attention to the basics, shore up the foundations, shore up those pillars. And that is a lot of times the main things you need to do to reward yourself with good health.
Right. Yeah. Oh, excuse me. So we kind of start with that foundational, we'll really build a good foundation, right? And then we can kind of go off of that onto the different directions that we need to based upon symptoms. And
we can apply those principles to a lot of things. And so with these subsequent podcasts, we're going to go over a variety of health topics and sort of riff on certain things. And we were debating what to start with. And, obviously me being a gastroenterologist, I said, well, and what's one of the main things we deal with? I mean, and you do too, as a primary care, across the ages is poop. So, depending on when we're deciding what to title this episode, there may be some, like poop talk.
Yeah.
Poop talking.
Right. Well, but it's a big deal.
It is.
Poop is a big deal.
Yeah.
Honestly.
And not pooping is a big deal.
And not pooping is a huge deal.
So today we're going to kind of go over just sort of the basics. We want to keep this episode shorter so we're not droning on for, hours and hours, which I can do as a gastroenterologist talking about poop, but really kind of focus on the basics. And we're going to go over some stats of how big of the problem is, with mainly focus on constipation, and then talk about the 5 things we need for a good number 2.
Yep, there we go. And I think we'll definitely hit on looser stools on another day, but today really is the focus is going to be on constipation.
Yep.
So when
preventing constipation.
Yes, the prevention of constipation. Let's not be backed up. Let's go with the flow.
So how big is the issue? Big enough where it can't be flushed?
Right? Yeah. Okay, this is going to be bad.
I know, I have to. I got,
You're going to have
This is what I've done for the last 15 years.
I know, I bet you have some good ones. I'm excited to hear. All right, so prevalence. There is a significant prevalence, right? And it is a little bit different in adults and kids. So, globally, they estimate 12 to 19% of the global adult population suffers from constipation. What about kids? What do we see there?
In the U.S., the estimates were roughly up to 30% of children experience constipation in any given year.
That's a lot.
Which is a lot.
So speaking of that, let's define constipation now, so that people understand. Like, there's a criteria that we use and use specifically.
So the Rome criteria, which is actually where a bunch of gastroenterologists got together in Rome, Italy, drank wine and talked poop. They were really getting drunk and talking.
Yeah,
okay. What? So anyway, in children, it's defined as having 2 or more of the following symptoms for more than a month. So having 2 or less bowel movements per week. So definitely less than 3 bowel movements per week. 1 or more episodes of incontinence, which is that kind of stool leaking or encopresis, or stool accidents per week. A history of withholding behavior, kind of doing the I gotta poop dance and clenching up.
Yeah.
Painful poops, the kid who cries when they poop. Presence of large stools in the rectum, like, you hear stories of in those babies where they can kind of see the poop there and it's stuck and it doesn't want to come out.
Yeah.
Or when you kind of feel around in their belly and you can feel a poop monster in there. Like a grapefruit of poop kind of stuck in there.
Yeah.
Or an older child, the one where you need to keep the stick next to the toilet because they keep clogging the toilet.
Right.
So those are all kind of criteria that can go into defining what constipation is.
Gotcha. Which I do think, sometimes it gets confusing for people when they, we talk about those large poops, right? And how is that constipation? And just kind of like... You
shouldn't be clogging the toilet.
Right, breaking it down. So that right there, just what you said, shouldn't be clogging the toilet.
Yes.
Yeah. Okay.
And then adults...
And why though? Why is that happening? Do you want to just... quickly.
And this kind of shows that this is a chronic issue, not an acute issue, because you don't go from 0 to toilet clogger in a couple days.
There you go.
Is the body accommodates over time, and the more that colon needs to hold on to stool, and the more stool it's holding on to, it will stretch and dilate and get bigger, and then you get into a vicious cycle where there's all this room, like a big garage. You can get a bigger and bigger vehicle to kind of park in there. So the stools will get bigger, and oftentimes harder. And then the child doesn't even feel the urge to poop necessarily until that stool gets big.
Right.
So on that between time, the stool's building up, and obviously this is almost always reversible through modifications that we do in GI all the time. But just knowing that that when they're in that cycle of like they go a bunch of days without pooping, and then it is a doozy, that their colon's getting stretched out, and it can. I've seen it get to unbelievable levels, literally where there needed to be surgical things that had to happen because their colon was so stretched out and just wasn't working at all.
Yeah.
But that takes years of constipation. So this is something you want to get on early and just don't blow it off. And I think it does get blown off a lot.
I think so too, especially because the other things with your kids, you don't always know when they're little. We seem to know, oh, they pooped today or they pooped 3 times. And then all of a sudden they're at school and it's hard to keep track, right? And
we call them ghost poopers.
Right. Yeah. Yeah.
Don't tell anybody. Don't talk about it.
Yeah.
Never admit it.
Never admit it. Certainly aren't going to go in a public space.
Yeah.
Right? And so the more we hold it, then we have more and more issues.
And there's still a lot, especially in peds, there's more likely to talk about it. In adults, and people assume certain things are normal, right? It might be your normal, but that doesn't mean it's optimal or truly normal.
Right. And the word normal, right? What does it really mean?
Yeah.
And so, you and I both talk a lot about poop in our office visits. And so we just try to make it more natural because it's a thing that we all do, right? Everybody poops.
And if it ain't working right, then everything goes downhill.
Yep, for sure.
And so in kids, there's like 1 out of 4 visits to the pediatric GI doc are for constipation. There's days in my career where it's felt like 1 out of 2.
Right. It's like every other kid.
And then 1 out of 20 visits to the pediatrician, general pediatrician, is for constipation. So people are addressing it. Sorry, that was something beeping on our monitor there, but we'll edit this little portion out.
Yeah, not sure. Okay, so you mentioned, there can be common visits with kiddos. It can happen in adults as well, right? And so a lot of times women will struggle with constipation, particularly around hormonal fluxes, right? So perimenopause, menopause, and then pregnancy. So we can really struggle with different
and there are a bunch of things that can be involved, hormonally, thyroid, all these things like that.
Yep.
Today, we're not going to go off into the, we're going to focus on the basics of like, all right, before we even think about some of these other potential causes, most cases of constipation are due to not addressing the basics, not addressing these 5 things we need for a good number 2.
Right. Yep. But again, so we're going to cover all of that today, like you just said. We'll probably hit on some of these other, factors of constipation and how they impact thyroid and menopause at a later date when we talk those topics.
Because I'd say the other things, food allergies and sensitivities certainly can be a cause. Yep. Hormones certainly can be a cause. Thyroid can certainly be a cause.
Right.
And so we're not blowing those things off.
No.
We're denying that they can be causative.
100%.
But again, if these other 5 things we need for good number 2 aren't being addressed, then the vast majority of constipation issues stem from, I think, these 5 basics.
Well, it's kind of just like we talk about the foundational pillars, right? We have to, this is the foundation
the pillars of poop.
Yeah.
The 5 pillars of poop.
5 pillars of poop. And another real quick one is just older adults. So once we hit a certain age, we do have, and it's not like it's a specific age, right? But once we hit a certain time in our life, we can have those systems slow down a little. So constipation can increase, but there are still things we can try.
And medications, right?
Polypharmacy. Yep.
So, the big ones are narcotic pain medications, which are notorious for causing. But there are a host of other medications. Some of the what they call atypical antipsychotics. Some of the psychiatric medicines are known to be motility killers and cause significant constipation. There's some different heart medications that can do it. They're so always look on your labels, but that could be a contributing factor.
Yeah, just there's
even more important that you are addressing these baseline things to try to make keep the problem from getting worse.
Right. Oh, for sure. Yeah.
So should we kick off on the 5 things?
Yes, let's do.
And number 1.
Number 1. What is the most number 1 thing we should be addressing with everybody that we don't enough?
Well, fiber is the number 1 thing, and what's funny is it's gotten short shrift for years, and even in the GI community, like fiber, like, but and I'm like, there's multiple reasons why fiber is important for pooping,
right?
And I don't know why it got such short shrift or like such like fiber deniers,
right? Yeah.
because it's, so I guess first thing, fiber requirements.
Okay. Yes. Fiber requirements for kids, women, and men.
Yes.
So kids.
So
what do we see for kids?
The general rule is, I believe it's age plus 5 is the number of grams of fiber that somebody should get per day. So
until what age?
And then I think until they're like the probably mid to later teens, and then I think it kind of would transition to the adult, the adult version. So that would mean like a 7 or 8 year old kid, should get 12 grams of fiber, a little bit more. A teenage or like an early teen or preteen should be getting probably 15, potentially 15 to 20 grams of fiber. And then what about women and adults?
Yeah, so women, we shoot more for 25 grams of fiber, and men, more like 40. 35 to 40, depending,
And what does the average American adult get?
Right, like 7, 8?
I think it's a little bit better, but I think it's like low teens.
Oh, I was thinking it was in under
kids,
10.
Yeah. And there's some kids, if you look at, especially kids who have like what we call ARFID, which is this, it's a really severe like sensory issues with food, and they tend to only like very processed foods and things like that. And some of these kids are probably getting less than 5 grams a day, almost definitely getting less than 5 grams a day.
Just because of those choices.
Just because of those food choices.
So many of the options out there are really low fiber choices. And so you have to be pretty intentional, and a lot of the foods that are high in fiber don't always have a label. Right, and so that can be hard for
because
folks
it's actually a food.
Because it's a real food, straight from something. Yeah.
Yep, and we have some handouts and things that we give to tons of our patients that have like a list of high fiber foods, how many grams of fiber in there.
Right. So really quick, speaking of fiber, tell us a little bit about the difference between soluble fiber and insoluble fiber.
Sure. So insoluble. Just like it sounds like it doesn't really dissolve. It's more like the roughage, the bulky stuff, the cellulose, things you get from a lot of plants. And so that's sort of like the stuff that pushes stuff through your system. It has an important role, I think, and as sort of that sort of bulking agent. But you need both kinds of fiber, the soluble and insoluble. And so if you just have a lot of that roughagey stuff, but you don't have enough of the soluble fiber, then I think you can run into problems as well.
Right.
And the soluble fiber, which is more the part that, like if you think of something like the stuff that makes oatmeal kind of gummy or the pectins and things like that in a fruit. And those soluble fibers, they absorb water, but they're also, the biggest thing with them is they are food. They're prebiotics. They're food for our gut bacteria.
Microbiome. Yep. So they're feeding your microbiome the good, healthy stuff.
Which is going to be, spoiler alert, is another important thing you need for a good number 2. But without fiber, probiotics do nothing. They'll actually digest you. In some cases. So having, which is why I don't know why you would ever pay short shrift to the fiber thing, because like you need it not only for the bulking, not only to kind of soften the stool and hold water in there, but you're feeding these all important gut bacteria that are crucial, and like 40% of the weight of your stool is dead bacteria or something along those lines. So, and you need products with both the soluble and the insoluble fiber in there.
Right.
So, the whole foods, the real foods, fruits, vegetables, 100% whole grains.
Yeah.
And I always talk about the whole grain roux, right? And you said like looking at the labels, is if it just says whole grain, that means nothing. Like legally, that doesn't have to mean anything. And you're like, it's just whole grain, but it's got less than 1 gram of fiber. But if it says 100% whole grain, then it actually has to be whole grain and have the fiber still in there.
Right, have the pieces.
And when you process food, what are the first things they like to pull out of the processed food?
The fiber, all the good stuff. Yep. I know I have a lot of patients that are kind of doing some of the grinding their own wheat berries and making their own bread so that they can have everything still intact in that bread, right? And again, one of the great things of what it used to be. And now we simplify it and buy store-bought, but a lot of it is stripped of a lot of nutritional value.
So I think if you can compare labels, sometimes you're going like, hey,
it's huge.
Which bread do I buy or whatever? The most basic thing is like, look at the food label and how many grams of fiber does it have per serving? And just sort of go, okay, at least this is better than this. And then you kind of look around, oh, this one has, 2-3 times as many.
Right.
Or if you look at something like pasta and you use some of that the banza or some of these like chickpea
pasta.
Yep. Or
we
the lentil pastas.
Yep.
They are loaded with fiber and protein, and
they're high fiber, high protein in one little package, and they taste
Yeah,
they're great,
yeah.
but you can't really tell that much of a difference between whole grain pasta if you ask me.
Yeah.
So
yeah.
that's what we use predominantly.
So if you can, opt for the whole grains, right?
Right. Yeah. Yeah, for sure.
Yeah. What else do you tell your adults when you're talking about fiber?
Sometimes, well, we talk about all of those things that you said and beans and legumes and chickpeas and all of that. And then sometimes we talk about, supplementing with psyllium, right? Because you just sometimes need that extra boost, especially if we're dealing with different food sensitivities and whatever. So we'll do.
You mean psyllium?
Psyllium, yeah, yeah. I know people always ask me how to spell it.
It's P-S.
Starts with a P.
Yeah, Psyllium,
Yep.
psyllium, which is the active ingredient in Metamucil. But you can also buy just sort of generic psyllium capsules, powders.
Yeah. You can add it to a smoothie. You can bake it in things
And so, why do you like psyllium?
Well, because it helps with that. It's that fibery piece, right? So it helps when I have folks that have a hard time getting it into their diet. It's just one extra way that we can still get the benefit in feeding with that prebiotic piece for the microbiome.
Lots of soluble fiber.
Yep.
You can blend it in, mix it in with stuff, although you don't want to mix it and let it sit because it will kind of gel up.
Gels up, yeah.
But it's nice because it will thicken up a loose stool, but it softens up a hard stool.
I know. So that's the one thing that I've always had people question me on, right? Because when we talk about that soluble fiber and I say, we can use it with diarrhea and with constipation, it can be real confusing.
But start slow, because what happens if you go from 0 to fiber?
Bad.
Bad. Bloat.
Very bad.
Yeah, you can get bloaty and uncomfortable.
Well, you're just too full, right? Yeah.
So, I tell people start with like a teaspoon, and you can put it in a smoothie, mix it with applesauce, mix it in with foods, and then slowly let your body accommodate. The other thing is you don't want to also ramp up on fiber, especially if you have a kid who's really constipated and they haven't been kind of cleaned out and unplugged. The last thing you want to do is add a bunch more fiber, especially if they have like a big plug down,
because it just makes it worse.
They're going to be miserable.
Yeah.
So you got to get things moving, and then use this to kind of keep things moving.
Right. So and that's something we'd recommend visiting with your provider about if you're doing a clean out or something, but then introducing that fiber after.
Yep. But it's I think you start somewhere, and it's just start slowly making better choices, slowly adding it in there, feeding those good belly bugs.
Yeah. So speaking of good belly bugs, what's number 2?
Yeah. So number 2, probiotics.
Okay.
Or a healthy microbiome.
Right. Healthy microbiome, yeah.
So we've talked about this, pretty much in every one of the pillars and stuff like that.
Yeah, because it really is applicable to every pillar.
Yeah, and so just to remind everybody, the gut microbiome it's the sort of set of protozoa, bacteria, viruses, all the bugs that live in your gut is the gut microbiome. And if you have a healthy gut microbiome with lots of things like lactobacillus, bifidobacteria, those are the two of the main species that make a lot of good things. These bacteria eat the fiber, and the products that they make your intestine move and work. They actually boost up your immune system. They bump up your brain. They help prevent type 2 diabetes. It's like the best of all combos is fiber and probiotics.
Right. Yeah, for sure. And when we talk, I know you have similar conversations with your folks, but we'll talk about like what are, easy things that you can add in, like with phytonutrients, right? And how do you understand like phytonutrients and how those kind of impact the microbiome?
The colorful, eating the rainbow.
I talk about the rainbow and getting a food from every color of the rainbow every day.
Because that's the other thing, besides soluble fiber, that these probiotic bacteria love to eat. They actually process these phytonutrients, the colorful stuff in fruits and vegetables, and they activate them so that they have higher antioxidant potential for you. And then they also use that to make the microbiome healthier. Right. So it's like a win-win.
Right. And, they're attractive, right? Strawberries, blueberries, red peppers, orange. I mean, it's just the things that we're kind of drawn to. So not only do they have good
soluble fiber, but then they're also they're feeding the microbiome several different ways.
Yeah.
So that like ties directly within that probiotic kind of gut microbiome thing. Converse of that, how many people have we seen who've gotten nuked with antibiotics and have major pooping issues?
Right, because they don't have anything left. All they have are
I see this remnants in the pediatric population all the time. So maybe in the biggest kind of thing, and this isn't a judgment, this is just sort of looking at what things can disturb that gut microbiome. maybe a kid who was born by C-section, maybe, mom couldn't breastfeed, so went on to formula that didn't have a bunch of prebiotics stuff in there, and so never got that initial inoculum of good bacteria, didn't get the prebiotics early on, maybe started having like ear infections and strep throats and got hit with a couple antibiotics that further like knocked their gut microbiome. And I've had kids who have that exact story who are some of the worst poopers in the world. And so then we try to do a whole microbiome restoration program, which kind of includes both the fiber and the probiotics and things like that. And sometimes addressing that can be a major benefit to somebody's poop schedule.
Yeah, for sure. Well, and even with adults, right? You think of all the foods we're eating that have thickeners and emulsifiers and all these other things that impact that microbiome.
Yep.
And we go in and we kind of revamp what we're eating, or, hey, I love this. All right, well, let's look at that and see if there's a way we can kind of recreate that in a healthier version that doesn't have the additives and is more of a whole food. Yeah.
Because I'm to the point, I think, of it without adequate fiber and a healthy microbiome, I don't think good poops generally happen.
I don't know how they can't, you know. I mean, it's tough, especially if you're eating from any of our American foods, right?
Yeah,
it's just tough.
The standard American diet is sad for your bottom.
Yep. You're on one today. You have a lot of good ones. I like it.
Yep, it's been a long road.
Yep.
All right, so suffice to say those two things. So the first things you need is the fiber. We got the probiotic or the healthy microbiome.
Yeah. What about your fermented foods? We kind of talked about that another day, but we ought to just bring it up right now.
Which also combines fiber and probiotic foods. So like, your sauerkrauts and your kimchis and some other fermented vegetables.
And so kind of, people ask me all the time, pickles, there's a difference between like the vinegar pickles and the fermented pickles.
Yep.
And so fermented ones are usually going to be found in the refrigerated section, and they taste a little different for sure. I come from a family who loves pickles, and so they noticed the difference.
Well, and the vinegar way is sort of like the quick, just jam that in there and get it the sort of pickly flavor. But the old school method really does have a lot of benefits, and and then real yogurt and kefir, not again the processed, highly processed ones. And I just saw something come through my news feed, and I will have to see if this is actually a study, but they supposedly went out and tested all these different kind of probiotic-y yogurt type of products, sort of commercially available. Yeah. And 16 out of 20 of them did not have any bifidobacteria in there. Oh,
interesting.
And so, by the way, when you're doing, if you're saying you're going to supplement probiotics or whatever for somebody who's constipated, the acidophilus or the lactobacillus, those are great for the upper GI tract, but they don't really do anything for pooping. So I think that's why I really like the more broad spectrum probiotics that have lactobacillus and bifidobacteria. So I think I always tell kids, think of bifido for your butt, because the bifidobacteria are the ones that live in your colon. They digest the fiber. They make those short chain fatty acids that are really beneficial. They help with the motility. They keep that colon healthy. And so we really want to foster those bifidobacteria. And so if you're looking to supplement, whether that's a fermented food or a probiotic product, make sure it's got several strains of bifidobacteria in there. If
we're looking at
if we're looking at poop and stuff, for sure.
Okay, perfect. So we just wanted to make sure we mentioned some of those fermented foods, just so people were aware.
Another route of great route of just everyday probiotics.
Yeah, and it don't have to be hard, right? Like they can be easy. I mean, a lot of us are doing yogurt and kefir and stuff like that, even if you're not totally into sauerkraut and kimchi and all that good stuff.
Yep.
Okay, what about so number 3? So the number 3 thing.
Agua.
Yeah. Yeah.
So this I guess is maybe a little controversial in some ways, because we don't know exactly how much, what is truly the optimal intake of water. And you hear all these recommendations, to be honest, are probably not super evidence-based, but bottom line is if you're dehydrated, then a lot of times your poop gets dehydrated, it gets harder to pass, harder stools. So it's a matter of making sure that that person is adequately hydrated overall, and making sure that enough of that water gets held in the colon, in the stool, to maintain a soft, easier to pass stool.
Right.
Because the longer that poop sits in the colon, the more water gets sucked out of that poop. And then, so if somebody's got really slow motility, like say if they're on narcotic pain medications or whatever else, or have a neurological disorder, that prolonged transit time is just going to suck more and more and more water until that literally becomes a rock.
Right. And then those are those rock hard stools that are hard to pass, painful to pass, sometimes cause tears, right?
Obstructions,
Obstructions, yeah.
So, but I think, the baseline of that is like we all need to get enough water, and and a lot of us are probably not drinking enough clean water.
Right, yeah.
What's your sort of rule of thumb of like decent hydration?
Well, I mean, I've gone across the board with this. My latest thing is I've kind of gone more to going to the bathroom when you're peeing, and every 2 to 3 hours, and it's got to be pretty light yellow.
Yeah.
It's kind of, versus giving an actual ounces amount.
Yeah.
And I do think it kind of has depended too on what exactly people are drinking, if it's plain water or, because, there's a lot out there with like not getting enough sodium and, not getting those electrolytes.
Yeah.
So I don't want to completely deplete, because you can drink too much water.
Yeah,
you
absolutely.
can have hyponatremia, which is too low of salt.
And your body can't hold on to the water because it's just kind of
it's actually not good.
Yeah.
And so you can overhydrate. So, I have those discussions, but I've gone back and forth on them with how, depending on what the issue is that we're talking about and how it's going to be best, used for that person.
But drinking 3 cups of coffee, and no water.
If you're only drinking things that are causing you to diurese, it's probably not going to be.
You're probably not having
ideal.
Optimal amount of water, and therefore not an optimal amount of water in your intestines.
Right.
So.
Yeah. But then they get the coffee. Come on, doesn't that?
Because they're saying like up to age 3, about 1 liter of fluids per day is recommended. And then the older kid recommendations, like roughly a cup of water per year of age, up to about a half a gallon per day for like a teenager, 64 ounces per day. Again, that's, I don't know exactly how good the science is behind that, but that's sort of a rough rule of thumb. But I think yours is good. If you're hydrated enough, you're going to be peeing
every 2 to 3 hours, and it's kind of a light yellow.
Yeah.
Yeah,
so,
if you're peeing and it's dark yellow or orange and you didn't take something that caused it.
And you're peeing once a day. We
have problems.
Yeah.
And there's no way you're hydrated.
And you're probably going to get a UTI.
Yes,
that's a side,
or kidney stones.
That's a whole side step. So, again, and also eating the foods that are going to hold some of that water in your GI tract, which goes back to the fiber.
Right, I know. It all comes back to fiber.
Yep. Which is why it's number 1 for a good number 2. All right, so exercise and activity.
Yeah, right. So, the whole inactive piece really contributes to constipation.
Yeah.
Right? Turns out. So when you're active and you're exercising, things keep moving, including your bowel, right? Including that intestine.
Yeah, I think it's on a couple fronts. It's overall just the neurochemistry, so just like stimulation. Just the movement part of it that kind of stimulates some forward motion. There's more like the neurotransmitter part of it that kind of fosters that going. I think just like the pelvic movements and things like that kind of facilitates. So I think it's beneficial on multiple fronts.
Right. And this is kids and adults.
Absolutely.
Yeah, for sure.
I think the opposite of that is the gamer lifestyle where you're basically eating, foods with 0 fiber. You might be drinking some soda. You're completely inactive. I mean, there's some of the worst constipators I have, and there were withholders.
Yeah.
Because they're too busy with their games, so they just clench down.
Right. Don't want to go. Take a break to go.
Yeah. And these are some of the like world-class toilet clogger people too.
Right.
So
yeah. Every 3 days.
I've seen this in my practice.
Right.
So and I say inactive child will often have an inactive colon.
Right. Yeah. Which makes sense, right? If you're moving your body and everything is moving around, you're having some, the motility of your body increases the motility of your gut.
Yeah.
So it makes sense.
And medically, there's obviously things that we're sort of talking about the general population.
Yeah.
But if somebody has like cerebral palsy or has a spinal cord injury or something like this. This is something that the PM&R docs and the rehab docs and things like that. This is a huge problem in that population because of partially because of this, the altered nerve input, but also just like the just less mobility, and so you have to make special contingencies in this population, and it's it's just we know that this has an interaction. So in that population, we have to take extra care to try to keep things moving.
Right, for sure. Okay, so then number 5. So we've gotten through 1, 2, 3, 4, number 5.
So good bathroom habits. And this, again, goes back to the withholder type of things, which parents out there, many of us have seen this.
Yes.
I call it the poop withholders ballet. Where you see them tiptoeing across the floor and their little butt cheeks are clenched.
Because they need to go.
They need to go, and they're poop deniers.
Right. Yeah. Well, they might be busy.
Yeah.
Right. Like
too much
playing,
stuff going on.
Too many things to go do. We don't want to take the time to go have a good bowel movement, right?
And it's a phase for a lot of kids.
Yeah. For sure.
But it can become...
Well, that's the problem, though. It can be a phase, and then it can become a habit, and then all of a sudden it's an issue.
Yes.
Yeah.
And, and then who wants to poop at school?
Right. Nobody.
There's some of the bathrooms, they don't have doors on the stalls.
Yeah, or they have huge cracks.
Yeah.
You know what I mean? And it's such a thing.
Or they're just nasty.
It's such a thing anyway.
Yeah.
But it's just, I get why kids don't want to. I get it.
So they're clamped down all day at school. And again, if you don't kind of get into a good routine where they can do that can, and some people just also have that kind of sensory phobia kind of thing. They just need the home field advantage to poop.
Right. Yeah.
And those are the ones I always try to work with the parents on retraining that kid's bowels so that they poop right away in the morning before school.
Right.
So they knock one out and they're not holding it all day. And that can be a game changer for them. And sometimes it takes a little bit of kind of tweaking. But yeah, the poop withholding, again, is that first stage on the poops get bigger and bigger, then they get larger and harder, and eventually you end up with a kind of almost a plug, and then they start leaking and having ascend capricis and soiling in their underwear. So you want to nip that in the bud as early as you can and just try to create good bathroom habits. Interestingly enough, toilet phobia is actually the most common phobia in children. I actually looked this up on like the child psychiatry website. I was like, seems like that to me, but that's because I'm a GI doc. But I was like, of all the things to be scared of, that toilet phobia is extremely common.
There you go.
Yeah.
You learn something
new
every day.
It's toilet snakes. Those damn toilet snakes get me every time.
Okay, so this is also one of the times where I feel like I am doing gymnastics in the exam room, trying to show them and talk to them about positioning on a potty, right?
Potty.
Yeah, but every time, because you have to kind of show what it does, right? Yeah.
Yeah, changing.
So squatty potty. What's a squatty potty?
I think it's trying to do the opposite of like the withholder, clench ballet. So it's a little footstool and it tilts their pelvis. And so that they're actually in a better position and it straightens out the poop chute.
Right.
So it's easier for that poop to kind of slide right out.
Yeah, and you sit it right in front of the toilet. So it's like you're sitting on a toilet and it's kind of like a fancy step stool.
Yeah.
Really. Yep. And then it just makes you have a straight shot out.
And earlier than that, those little floor potties you have when they're the training potties, and some of them have a little song, like they'll have a little music thing in there when they pee in there and it plays their little princess song or whatever it is. But that if you look at the position they're in when they're sitting down in the little floor potty, that's actually great because their knees are up, their butt is down, they're in that good squatting position. So the squatty potty tries to simulate that when they move on to the big boy toilet or big girl toilet.
Right.
But just kind of keep that pelvic tilt right so that it's harder to withhold and it's easier for the poop to come out. So I think that's good. And just really trying to get a good routine.
Yeah. Routine is huge.
Yeah.
And really fast with the squatty potty. I use that with adults too. So honestly, we have that conversation not just with kids, but with adults as well. Yeah. But routine is key. And kind of when you have your routine, being able to hang with your routine, right? And not ignoring the call of nature when it comes.
And when is the time that a lot of people get really constipated?
Well, like with travel or with, So, travel or if you are on like a swing shift. Yeah. Right? That can be a doozy too.
Knock your whole
It does. It
off.
Changes everything. I know. Travel is so hard. It's lovely.
Yeah.
But
yeah, so some people I never need laxatives until I go on a trip or whatever. Speaking of which, I always like to include this in whenever I talk about constipation because it's sort of a pet peeve of mine. So Miralax, one of probably the most common laxative for use just for, again, public education and awareness. Interestingly, never has been FDA approved for use in children, and we use it all the time.
Right.
I really try not to.
Right.
I like it for clean out, but I don't use it chronically.
Right.
But it's again, I mean, it's sold by the bucket in in Costco and everywhere else, or all the generic equivalents. But Miralax has never been approved for use in kids. It's never been approved for use for more than 2 weeks or longer. So just so you're aware, you're not saying that it's like harmful to kids or harmful if you use it for longer than that, but it's the majority of use for this medication is off-label, and no child or adult in the history of mankind has ever suffered from a Miralax deficiency.
Right.
You know, so.
Right. But you also mentioned like using it as like a quick clean out, which again, we're not like trying to prescribe anything for anybody during this, but that's short term. That's the whole point, right?
It's short term. Yep.
It's not a long-term situation. Yeah.
But people do suffer from fiber deficiency. You know, they do suffer from magnesium deficiency, which can also be very useful for helping poop.
Right.
And something we start a ton of our patients on.
But not Miralax deficiency.
But not Miralax deficiency, no. Yeah. So, you know, and it seems it's a shortcut to thinking. It's like, just throw the Miralax. Well, why don't we look at the 5 things you need for a good number 2? Address those. And then if things are not getting better and you're addressing all those, then start thinking about those other factors. Could there be a thyroid thing? Could there be celiac? Could there be hormones? You know, all these other.
Right.
But I think it always pays to address these basics.
Oh, for sure. Just like we said in the very beginning, the foundations of health, right? These are the foundations of a good poop.
Yep. Yeah. And so those are the 5 things we need for a good number 2. Again, to reiterate, it's fiber, probiotics or a good healthy microbiome, water, exercise and activity, and good bathroom habits.
Yep. All right. Well, we will cut this one off there. I think we've covered our...
So you snuck one in there. Can't help it.
You just can't help it. And we had to enjoy this one, right? Because when else do you get to talk about poop for a straight chunk of time?
But it's important things to think about because it does affect, and as a parent, it will affect you at one point or another.
Yeah, for sure. Thank you again for listening. We really appreciate everybody who's taken the time to download our podcast. Please, like us and share the podcast. Again, shoot us a comment. Let us know if you're interested in certain topics. But again, we have some more topics like this that are going to be coming up in the near future.
And at some point, I'll try to get some of these handouts loaded on our website where people can kind of get them. But I need your husband's help because
our website designer.
Yes, because he's the tech savvy one of the bunch.
Yeah, it's not us.
No. All right, everybody. Thanks for listening.
And thanks really fast to our producer again, Triple Divide Creative.
Yep.
We're super appreciative for everything that they do.
Thanks, Brandy.
Yeah, thanks.